28,000 people that came forward to testing. Dr. Chant and I yesterday made a really big effort to encourage those higher rates of testing, and I'm really pleased we've seen that happen to 8 p.m. last night, and we can't stress enough how important it is to keep up those high rates of testing. To 8 p.m. last night, there were 10 cases of community transmission in New South Wales. 5 were directly linked to the Avalon cluster. 3, as we'd already foreshadowed yesterday, were members of the Croydon cluster, which we foreshadowed. 1 is a link to the transport worker cluster, which we'd previously spoken about, and 1 is under investigation. There's a chance it's an old case or else a false positive, but serology is looking at that. That's the 10th one. So pleasingly, we've seen the numbers go down today, but it's very volatile. They're going to bounce around, and what is really important is for all of us to do everything we can to reduce our mobility, to reduce the number of people that we're mixing with, and to make sure that we stick to the rules and the health advice that's been provided. Can I stress again, if you're in an indoor place, if you're going grocery shopping, if you're in a place of worship, you have to wear a mask. You should be wearing a mask. But obviously in outdoor settings, if you can't guarantee social distancing, if you can't guarantee all the other factors which make it COVID safe, you should also make sure you're wearing a mask. And I want to thank people who've been doing that consistently. And of course, you shouldn't be catching public transport really at this stage if you're not wearing a mask. And we want to strongly continue to encourage that. That's been what we've been saying from the outset. But at this stage, in dealing with the pandemic, dealing with the outbreak, the most important thing is for those testing rates to remain high. If you have the mildest of symptoms, please make sure you get tested and stay home until you're advised otherwise. Make sure also that you're looking at the New South Wales government websites to see where those latest venues are, to determine whether you've been a close contact or a casual contact, and to follow the health advice. That is really, really important. As Dr. Chant, myself and the Minister have foreshadowed, we'll have more to say later in the next few days about the Northern Beaches. I want to thank the Northern Beaches community for their patience, and of course we're looking forward to be giving some relief to the southern part of the Northern Beaches from the 3rd of January, and we'll make that clear on the 2nd. And of course, the northern part of the Northern Beaches community, we're asking them to respect the stay-at-home provisions and also the outdoor rec numbers until the 9th of January. Tonight is New Year's Eve, and ordinarily our activities would be very different to what we're asking everybody to do, but I appreciate and understand most people completely appreciate why we've put the restrictions in place that we have, and I want to thank everybody for their cooperation, and I want to thank everybody for taking the current situation seriously as we need to. Dr. Chant will obviously provide a detailed update on the cases, but it's really important to make sure we keep those testing rates up. And given the change in circumstances for New Year's Eve, Assistant Commissioner Willing will give a police update on some of the operations they're undertaking to not just ensure that crowds stay away from CBD and those major thoroughfares, but also to make sure compliance. Make sure if you are going to a hospitality venue this evening, you've already downloaded the Service New South Wales app. Make sure if you're a business, you've got the QR codes in place to allow your patrons to come in and out safely, so we know exactly where everybody has been. And please, the last thing we want is to welcome in 2021 with a super spreading event. 2021, all of us are hoping, will be easier on us than 2020. And let's start the year off on a positive foot by doing the right thing, by respecting the restrictions that are in place, but also demonstrating common sense, because good government policy and restrictions doesn't cover every situation and every single venue and every single circumstance. So there is also an element of exercising good common sense, which the good people of New South Wales have done to date, and we ask everybody to please continue that. I'll ask Dr. Chant now to give her update, and then Assistant Commissioner Willing will provide a police update as well. Thank you.
New South Wales recorded 10 new locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 5 locally acquired cases are linked to the Avalon cluster and are close contacts of previous cases, and this cluster now numbers 144. 3 locally acquired cases are linked to the Inner West cluster, the source of which is still under investigation, and these cases were close contacts of cases reported yesterday, and in total there's 9 people associated with that cluster. 1 is a locally acquired case, is a close contact of one of the 2 patient transport drivers reported previously, and 1 potential case from Western Sydney is still under investigation, and I'd like to thank that gentleman for his cooperation in undergoing repeat testing and serological investigations. So we're treating that as a case. pending the results of those further investigations. 7 cases were acquired overseas and are in hotel quarantine, and it brings the total numbers of cases to 4,734. So in terms of testing, as the Premier had indicated, testing numbers were increased to 27,894 tests to 8 p.m. last night, and that compared with 17,267 in the previous day. So it does reflect the community response to that call out for testing. But can I urge the community to even strive for higher testing rates? We need to be sure that we are not missing any unrecognised chains of transmission. So everyone across the state with the most minimal of symptoms, please get tested. And it's important that if you have any symptoms today, do not go to any functions or gatherings. Get tested and isolate. You do not want to be or contribute to super spreading events which lead us to have to take other further public health measures in 2021. I would also like to thank and acknowledge the cooperation of the Northern Beaches residents and other residents across the state that have been identified as close contacts at some of our high-risk venues. I thank them for their cooperation in the 14 days isolating, but also would like to stress that I'm asking them to go that extra mile and make sure that they get a test towards the end of their 14 days, around day 12. They will then have that result available on day 14 and then can safely leave that period of quarantine. The reason for that is we want to make sure that we don't set up another chain of transmission. So whilst COVID does cause symptoms in many, the symptoms can be incredibly mild and people can overlook those symptoms, and it is critical that we get that exit screening. We are reviewing the number of people that have had that exit screening because we can cross-check our databases, and that is one of the key indicators that will give us confidence in knowing that we have sufficiently impeded any ongoing transmission in the Northern Beaches. And so I do ask for your cooperation and thank you for undertaking that testing. In terms of the Avalon cluster, we have 5 cases linked to the Avalon cluster today, including 2 cases who are close contacts of a person from Northern Sydney who was reported yesterday and is now linked to this cluster, along with his 2 close contacts reported today. So just to recall, this was a case that travelled into Pittwater Place in Mona Vale for work purposes between the 13th and the 19th of December. We are urging anyone who attended Pittwater Place between the 13th and the 19th of December with even the mildest of symptoms to get tested. And this is because at that centre, we know there were a number of people that were infectious at times. We know that there was a gym involved, and we know that there were other sites within that Pittwater Place between the 13th and the 19th where you may have crossed over with someone who was infectious with COVID and inadvertently been transmitted. So we're urging anyone who was there between the 13th and the 19th who's had even the mildest of symptoms, even recently and even if they've resolved, to go and get a test. The 3 other cases reported today linked to this cluster were all close contacts of previously recorded cases, the Paragon, the Narrabeen School and the Delhi, and we appreciate the cooperation of those close contacts. So in terms of the Inner West cluster, 3 new cases today are all members of the same extended family and linked to the Inner West cluster, the source of which is still under investigation. These cases were close contacts of the cases reported yesterday, and there's totally 9 cases related to that cluster. I just want to go through some venues that we're really urging everyone. There are new venues from that cluster, the Croydon cluster. There were a number of those cases that have been out and about in the broader Sydney. It is critical that people check the website because that information will be updated. You can imagine that sometimes people forget they've been in certain venues but then later remember, so please keep checking that continually throughout the day, and we'll be issuing alerts as new information comes to hand. But I particularly want to draw people's attention to a couple of venues. So anyone who visited any of the following venues at the listed times is considered a close contact who must get tested immediately and isolate for 14 days regardless of the result. So in relation to Bankstown, there is the Monkey Mania Bankstown Sports Club at 8 Greenfield Parade if you were there between Monday the 28th of December from 10 a.m. to 12 p.m. the Bankstown La Piazza Bankstown Sports Club on Monday the 28th of December from 12 to 2 p.m. Bass Hill Hair Management in Bass Hill Plaza from Thursday the 24th of December from 11:15 to 12:30. The Venus Nail Salon on Thursday and Bass Hill on the Thursday the 24th of December from 12:30 to 1 p.m. Kings Park Anytime Fitness Kings Park on Sunday the 20th of December from 9:30 a.m. to 11:45 a.m. And then anyone who attended the following venue at the listed times must get tested immediately and self-isolate until they receive further advice from New South Wales Health. And that's at the Bardwell Park, Earlwood Bardwell Park RSL on Monday the 28th of December from 6 p.m. to 11:30 p.m. And then anyone who visited the following venues at the listed times is considered a casual contact, and you must get tested immediately and isolate until a negative test, and obviously get retested if you develop any symptoms in the next 14 days since your exposure. So that's the Rhodes Priceline Pharmacy in Rhodes Waterside from Thursday the 24th of December from 9 a.m. to 12 p.m. In Bass Hill, BWS Bass Hill from 1:10 p.m. to 1:30 p.m. on Thursday the 24th of December, and Casula at Casula Mall at 1 Ingham Drive, Casula on Thursday the 24th of December from 6:30 p.m. to 8 p.m. But I just would like to indicate the information does get updated, so please go to the New South Wales Government website for the most up-to-date information, and thank you everyone for your cooperation in adhering to that isolation period. I know it's an impost, but it is critical to prevent further transmission of COVID.
Good morning, ladies and gentlemen. As you're aware, there were some changes to the public health orders yesterday. I need to reiterate that those changes will not impact on the policing operation that has been stood up to police this New Year's Eve operation. The Police Operations Centre is currently up and running. We're in the process of standing up a number of forward commands across the metropolitan area and in regional New South Wales. Again, I need to remind people, if you are looking at coming into the city, you need to have a New Year's Eve pass. We're encouraging people not to travel around if you don't have to. You need to abide by the current health orders, and it's incumbent upon individuals to understand the current health orders as they apply to them. So please check out the website and make sure you know the orders as they apply to you. In terms of the operation itself, you are going to see large numbers of uniformed police officers out and about. We'll be checking licensed premises. We'll be door knocking where necessary. We'll be out and patrolling public areas to ensure that people abide by the current health orders. This is about community safety from our perspective, COVID safety, and ensuring that people have an enjoyable night, getting through New Year's Eve in the most safe way as possible, and ensuring that everyone sees in the New Year's Eve in a safe way.
Contact traces and are breaching the quarantine and are lying because of the safety $1,000 in fines? And would you consider offering amnesty for, say, a 36-hour period so people can tell the truth to contact traces and then get everything they need?
Cases have been very forthcoming. There's been a small number of cases where we've had to use additional powers that we have under the Public Health Act to require them to provide certain documentation, and that could include things like bank statements or various records. So we do have a number of powers, but I would just like to say that our experience is that in the main, people are very cooperative. There has been only a handful of cases where we've had to use other means, but we also do cross-verify information. We cross-verify information from people around the case and their workplaces and other information sources. And if we have a reason to question the veracity of the information, we use other mechanisms. You know, we've reviewed CCTV footage and other things. So we do the best we can, but I can urge and remind the public that our aim and intent is to stop COVID transmission. Please be open and honest with us. I think many times I've said to you I won't give you more information, where we will not be releasing it in the usual course to police or any other things. So people need to be confident that our primary role is health, and we are going to try and maintain to the utmost your privacy. And in the end, we will probably find out if there's ongoing transmission that you were the cause source of it. But as I said, my mainstream experience with the public is that they've gone above and beyond. You know, we've had people drive back home and check receipts for us to get the timing, check back statements. But we do use multiple sources, and in the main, I really am appreciative of how people are open and transparent with us. But I am giving you that assurance that that's our focus. So please be honest with us.
Dr. Chant, is the genomic testing back yet on the inner west cluster to see if it's the same strain as the northern?
It was due to be coming off the genome sequencer at about 11:15 today. They need to do some analysis and cross-checking and check it against things. So I'm expecting that result later this afternoon.
Will we get an update on that? Because it's kind of
yes, certainly.
All of a sudden, the Croydon cluster is not so much the Croydon cluster, it can be linked to Adelaide.
I think it is a big deal, and it is what we would expect. But what we want in epidemiological terms, to be perfectly frank, is to have it nicely linked by person-to-person transmission, so we know that we've got the full spectrum. What concerns me is when I have those missing chains of transmission, because it means that we haven't effectively stopped the spread. And that's why it's important that as we go about on New Year's Eve, we really reflect on our behaviours. The more we can minimise our non-essential travel, the gatherings, let's just be very safe over this period to give us a chance to mop up any unknown transmission chains in the community. And that's why it's so important that the community comes forward for testing. I think the cluster highlights that. If we had not have had that person come forward for testing, those 9 cases may not have presented because the symptoms are so mild, and some of them had very minimal symptoms. We would have potentially had further chains of transmission in the community amongst their close contacts, and an escalating number of cases. So this, I think it illustrates the point we've tried to make. Everyone who's got symptoms needs to come forward and get testing.
Dr. Chant, the Northern Territory government has listed 7 Sydney suburbs, including Berejiklian and Sutherland, as hotspots, and requiring people from those suburbs to isolate in the community. Why don't we know about that?
So we release all of the venues that are known to be a risk where people have been. Certainly things like we haven't, if there is a venue where we know fully everyone who has been there, or it's been a workplace, again, we don't, where we've effectively got everyone, we don't necessarily put that out. And that's our practice, again, to protect confidentiality and to have faith in the system. We are aware of a case that has spent some time in Lillipilly, but that is being followed up with by public health, and it relates to a workplace.
So are there any cases in Sutherland?
I would have to check if there are any cases in Sutherland. So we're not concerned particularly about Sutherland. What we're concerned about, from the public health perspective, I'm concerned about the venues and venue exposures where people have been. So I'm concerned about the list of venues that I've read out today, because we would consider those to be high-risk transmission venues. I'm not concerned about general community transmission in that area. The focus is for people to be following the public health advice. But as I said, we can't be complacent. You can be anywhere in the state of New South Wales and at risk of COVID. So it is critical that you don't think, I'm just in rural regional, I'm just in, I haven't been into the CBD. You need to all play your part and come forward and get tested.
Can I ask just on the Croydon cluster, are there any more details in terms of the 3 new cases? Do they belong to those same 3 households, or is there another household?
That's correct. So these are cases that belong to those 3 households. There were a number of functions that occurred in the preceding time to Christmas and Boxing Day. The cases have occurred in those very close household contacts, and to date we haven't had transmission beyond that, but it's too early to tell. And those cases, though, were out and about, unknowingly infectious, and those reflect the venues we've announced publicly. And it is critical, because some of those venues we are asking you to isolate and get tested. So it means, and I'm very sorry for this, but your New Year's Eve plans will have to change. I understand that many people will have been protocolled last night, so that's where we've got the text message numbers and people will have been advised. Our contact tracing team will be calling people, but please do not ignore that message. You are a close contact if you've been protocolled for that with that advice. You need to act immediately. Get tested and isolate yourself.
Make it mandatory.
Total numbers for the venues, but we get the venue lists, and as I said, that's the beauty of having sort of QR codes where we can, where people do the telephone numbers. If people have entered the correct telephone number, it makes it quite easy for us to do those messages. Depending on the venue, we've got a variety of messages. Sometimes we do what's called a stop and stay, and that's where we say just isolate where you are, isolate, get tested, and we'll get back to you, and that's because we're trying to assimilate more information. So please bear with us. Sometimes we will update our public health advice, but that's because we have new information that comes to hand that changes our perception about the environment being at risk.
So, can I ask you about the Conceal the Crossroads outbreak? And take it back some months. There were calls back then as well, and I'll probably ask the Premier about this too, that perhaps there should be a citywide lockdown. People were fearful of what might happen, seeing what happened in Melbourne, etc. You resisted that back then, and the science proved correct. It was able to be controlled. How are we on track right now with the growth chart and projections of COVID compared to back then?
Look, I think it's important to know that this is a little bit of a roller coaster ride. What we're seeing is two factors. We're seeing transmission occurring in close contacts of people who were infected in the original seeding events. And so over the last few days, a number of the cases have been those close contacts. And we know that that means that transmission occurred in those households prior to us being able to identify the case. We see that because we know household transmission is the greatest risk. That explains why we're taking such hard line on household gatherings, because we know the high risk. When there are cases that are occurring and they've been in isolation for the full infectious period, so that's usually around 48 hours before symptom onset or 48 for a period after, when we know that people haven't been out and about infectious, that gives us confidence. So there's some of these cases have been detected at day 10. People have been isolating for actually 9 days. So there's not any risk that that person was actually out and about infectious. That's different from these Croydon cluster cases because they've just been picked up. So that's the distinction between the two categories. The ones that are contacts of cases or household contacts, we then look at whether they've been in isolation for the full infectious period, and that group doesn't pose a risk of any ongoing transmission. But the Croydon cluster cases, we know were out and about whilst infectious unknowingly, and that's why it's important that the community respond to our warnings around those sites and venues and the general warnings around getting tested.
Sorry, just in terms of the trajectory though, compared to Crossroads, just so people of New South Wales have some idea, thank you, on where we sit as a report card, I guess, now compared to the trajectory back then, which was able to be controlled. Are we looking better? We're tracking pretty well the same?
I would say that there are similarities in terms of the trajectory, but I would like to say at Crossroads there were times when the numbers were increasing and the times were decreasing, and there were times when we were concerned, incredibly concerned. So what my position is at this moment, and then what my position will be once I get updated with the data, could change, and I think that shows the volatility of it. And I think one of the things we've learned through the COVID response is that we have to be responsive to new emerging information. Our risk level changes. Until we got the Croydon cluster, we were on a more pleasing trajectory. Obviously, the Croydon cluster has raised that spectrum. But if we start seeing cases where we don't know the source of them, and particularly in the presence of low rates of community testing, that really elevates our risk threshold, and it means that we will be having to take even more precautionary actions. So the community has a part to play. The more you can practice those COVID-safe practices, the physical distancing, the hand hygiene, and don't risk it. Minimal symptoms, you stay home, get isolated. Our testing clinics are open, so please get a test. The sooner we can find any unmissed cases in the community, the quicker we can close down those chains of transmission.
Do you know anything about, with the public health alerts, can you just explain, so do you put out every venue that a positive case has been, or do you only put out the ones where you believe you don't have everybody's details?
So we have a low threshold for putting out the public health alerts, but for instance, if it was a contained workplace where they had good registers of everyone in and we knew that we'd contacted everyone, we wouldn't necessarily name that workplace, and that's because also it protects the privacy of individuals, and we also want to create a setting where people feel safe to get a test and make sure there's no perverse incentives. But we've, I think, named a large number of casual venues, so people that have gone to shopping centres. You've seen the spread. I think that's a key issue. For very minor things where someone might have just not had any, like a contactless pickup where there was very clear there was no interaction with anyone, then we wouldn't necessarily name that. We might just do some work around that. So really we generally have a very low threshold for announcing it. We've got that 2 categories of close contact venues and then those more casual venues. But there are circumstances in which we don't, because we know we've got everyone who could have been at that venue.
Do you have any details about the Victorian cases, the 3 that they say came from Sydney? Are they connected to the Avalon cluster?
Look, I think I'd just like to acknowledge the cooperation of our Victorian colleagues. We're working very closely with them. We've been communicating overnight. And we're ready to assist them with any details. Clearly they have raised a spectrum of someone who's returned from New South Wales. We're waiting. We understand that person is being tested. We'll await the outcome, but we certainly are here, and we're working very cooperatively with Victoria to investigate anything, because it has ramifications for us, because if there was a person and they'd been to venues, we're just as interested as Victoria in making sure that we've closed down any chains of transmission in New South Wales.
There was a made it mandatory to wear masks indoors. Is that something that you consider here?
Certainly, look, I think we can't be strong enough. If you're going into indoor venues, when you're anywhere that you can't social distance, wear a mask. And look, the community's been so good to come along with many other elements. We're really just urging the community to redouble your efforts. Please wear a mask.
There was an alert for a consumer pharmacy, so there was an alert for a consumer pharmacy. Can you just explain, is there COVID in the Blue Mountains as well?
So these are places, when you've got a group of people, they will have gone to a number of places. They may work in certain places, they may attend or frequent certain places. So that list reflects places where infectious cases have been present whilst they were infectious, and the guidance, whether to isolate or to watch out for symptoms, reflects the assessment of the risk posed. So clearly venues that we've identified as close contact venues, those venues reflect the highest risk, and that's why we're asking people to take a very precautionary approach and isolate for the 14 days. And for the casual contacts, we're asking you to often get a test and isolate till you've got a negative result. But should you develop symptoms again, it's important that you get retested.
Just a question. I know we spoke about it yesterday, but on the SCG test, and I asked a question with obvious recognition of your public health credentials, but a number of other public health experts and epidemiologists have spoken this morning, saying that they believe that it is too much of a risk to have crowd at the SCG, especially given that people who might pick up an infection on a New Year's Eve gathering would potentially be at their most infectious on day 1 of the test. Do you still believe in good conscience that test can go ahead with 24,000 people?
So I think even in my response yesterday, we said that we would continue to monitor the situation, and the situation just changes so rapidly. I don't think we've been ever fearful of changing our advice or putting in additional controls where it needed to be. So we are very much keen to work with the SCG to make sure their COVID safety plans are robust, but also if the situation evolves and we're more concerned about community transmission, then we will take the appropriate and provide the appropriate advice to government. So I think it's really clear that this is an evolving situation, and we will update our advice accordingly.
So we're not too far away from being 200 active cases in Sydney. Is there a certain number of cases or reach before you lock that down?
So look, we also are doing some work We are generally people are non-infectious after 10 days since onset of symptoms. So we are doing some work, and that's according to the CDNA definitions and the nationally agreed definitions of generally. So if you're not a hospitalised patient, if you're not a very sick patient, if you're not immunosuppressed, generally you are clear of being infectious 10 days after. So that's if you've remained symptom-free for 3 days and it's been at least 10 days since your onset of illness. So we are pleasingly getting to the period where a number of our cases will be now non-infectious, and we are working through that to better update the community on the infectious burden. I should say that the vast majority of those cases to date have been also in the Northern Beaches area of the northern part of the Northern Beaches, and that's why that community has borne the brunt of the tighter restrictions. And that is the reason why we've had those stay-at-home orders, the limitations on household visitors, again to reduce inadvertent transmission. And that was partly why I was saying and urging that community and explaining to that community why it is so critical for you to also get that clearance swab. We have got many people, many thousands of people in the northern area of the Northern Beaches that have been in isolation. But if they could do one further act by getting that clearance swabs, and I'd like to say thank you to the vast majority of people who have actually undertaken that swabbing. But I hope my explanation today highlights the importance of having that further piece of information.
A question for Mr. Willing, please. In terms of the SCG test, traditionally police will be there with plenty of resources to monitor antisocial behaviour. Will you have more resources this time to monitor COVID safe distances, etc., given the fact you have to be placed all around the ground, and would you be threatening people to kick them out?
A couple of things in relation to that. It's important to realise and remember that we've been policing health orders for many months now in a variety of different circumstances. So we always have a number of resources that are dedicated to the New Year's Day test. That won't change. We'll follow the health advice and we'll act accordingly, but we'll have sufficient resources to deal with anything that arises there as well. But, again, we will just have to see what happens in the next few days.
More resources or the same as you ordinarily would?
More resources in relation to the enforcement of health orders, but again, a flexible approach is the way that we're approaching all of these operations, and we've been doing this for many, many months now. We have a well-deserved good reputation as a police force for policing major events, including events like the New Year's Day test, and it won't be any different.
Are you concerned about large pop-up gatherings tonight, and what will we see from your officers out in the suburbs?
Yes, of course I'm concerned about that. We're hoping that people apply some common sense and abide by the health orders, but we'll have a lot of resources out there. As I said a couple of days ago, you'll see a large visible policing presence out there. We have the flexibility to move resources around into different areas across the metropolitan area to deal with anything that arises. But again, I have to reinforce and re-emphasise, we're asking people to take some individual responsibility here as well. Understand the health orders as they apply to you and restrict your movements around Sydney. You do not want to be responsible for spreading this disease.
Do you encourage people to dob in their neighbours?
Look, we get information from a variety of sources. So, at the end of the day, if we receive information that we feel we have to act on, we'll be doing that.
Mr. Willing, before we lose you, what are the rules regarding people from the southern part of the Northern Beaches moving into the northern part of the Northern Beaches? The reason I ask is because Christina Keneally has this morning accused Tony Abbott of travelling from the southern part where he currently lives to the northern part of Church.
I'm aware of that, and at the end of the day, that matter was investigated. Now, police responded to that, spoke to the former Prime Minister and formed the view that he was not in breach of the health order as it applied at that time. But you need to apply some common sense here. Stay at home where you can. Stay within your areas. Like if you're in the southern part of the Northern Beaches, stay within the southern part of the Northern Beaches. And the same applies to the northern part.
Why was he not in breach?
Well, in relation to that, he was out with a lawful excuse exercising with another individual. That was checked and proven to be right.
Brilliant. Can we ask, Victoria's had a huge outbreak, they've now got 3 cases and they're going to make masks mandatory. Why is yours approach so different to Daniel Andrews?
Well, that's you'll have to ask the Premier down there. I think it's been evident during the course of the pandemic that every state leader, every territory leader has had their own policies in place. I mean, every state and territory is different, every government is different. Here in New South Wales, we always try and strike the right balance. This is a very unpredictable, contagious disease, but we also appreciate that we don't want to put more burdens on our citizens than we need to, and it's a very fine line. But that's why our approach in New South Wales is to regularly update our health advice, our policy settings. If Dr. Chant or the health experts advise us to go down a particular course, we will do that quickly and nimbly and flexibly. And I just say, look at our record to date, and it's a very volatile situation, and none of us can afford to be complacent. Quite the contrary. At this stage of our response to the current outbreak, you will see a lot of volatility. Numbers will continue to bounce around as those close contacts in all likelihood start to develop the disease, and if they're in isolation, that's no cause for concern. But if, like the Croydon cluster, we can't identify the source of the infection, that is enormous cause for concern. It's very volatile, and every Premier has, and every state leader has their own settings, their own health advice. And I have a complete confidence in Team New South Wales and the way we are approaching this. But of course, should there be something that comes along where the health advice changes, should we need to adjust our policy settings, we will, as has been evidenced this week and last week. We won't hesitate to keep the public safe. Our first and foremost priority is always community safety, but at the same time we also have a keen eye on mental health, on making sure we preserve as many jobs as possible and livelihoods as possible, and that we bring the community with us. And I just want to thank everybody. It's the last day of the year, and what a hell of a year it's been. I just want to thank everybody in New South Wales for your cooperation and patience and respect, and hopefully 2021 will be easier on all of us. But I have confidence in our settings, but it also is up to all of us to do the right thing and to exercise good common sense, and to make sure that we always have a response that matches the risk that's posed to us. And if that risk goes up, well, then our policy settings change. If the risk goes down, well, then obviously those settings change.
I know you don't want to preach to other states in terms of how they should respond to COVID outbreaks, etc., but it strikes me as a massive disparity between us in New South Wales currently managing 18 yesterday, 10 today, a new cluster, versus Victoria, where there have been a few new cases and masks are now mandated indoors, everybody diving into the bunker. How do you feel about that? Do you feel that is overkill?
Look, I don't feel it's my position to comment on that, because we can't afford to be complacent. It only takes for one case, undetected, to go and spread it to many others for there to be an outbreak that we can't control. And so the last thing I would ever be is complacent. Quite the opposite. Our approach in New South Wales is cautious, and we believe proportionate to the risk that's there. But we also are very conscious of the fact, I mean, I think very clearly every time we get advice that allows us or causes us to put restrictions on our citizens, that is a big deal, and you need to make sure you do it in an appropriate way. So every decision we take, we think about the consequence on our citizens and what it means for them, and what it means for them not just today but in a week's time or a month's time. And that bears heavily on me personally, but also on the government. And so we want to make sure that at every stage we've got the right measures in place. But because the pandemic is unpredictable and it's volatile, we also always say to the community, we're prepared to change things. We're prepared to change settings suddenly and immediately if we have to. And that is, I think, the way to deal with this, but every state leader has a different approach.
There's been a lot of criticism about the cricket going ahead. Do you still stand by the decision and that it's a good idea to host the cricket test in Sydney?
Well, we stand by our decision to make sure we're able to provide COVID-safe events. And as Dr. Chant said, if we need to re-evaluate some of the settings, some of the health settings, update our advice, update the compliance measures, update the COVID safety plan, we won't hesitate to do that. We won't hesitate to do that. But if there is an opportunity for us to hold events that are COVID safe, we should also proceed on that, because at the end of the day, what's on the line, yes, community safety always comes first, and I hope we've demonstrated during the course of this year that we've always put community health and safety first. But we also have to keep jobs going. We don't want to see more people out of their job, out of their livelihood, and we want to make sure that we try and have a sense of normality. And if we can do that in a safe way, we should. But if anything changes, it's evolving, if we have to improve the settings or make things tighter or stricter, we won't hesitate to do that. Community safety always comes first. But if there's an opportunity for us to also protect jobs and to improve the morale of our citizens and to keep mental health high and to try and have a sense of normality, why shouldn't we strive for that? And that's why in New South Wales I'm proud of this strategy that we have in place, which always puts community safety and health first, but also considers the other consequences of our decisions. And for all those reasons, we'll make sure we get updates every couple of hours on the evolving situation. And if we need to change any settings, we won't hesitate to do that.
Can you provide a guarantee that you will find out what the original source of this outbreak is?
Which one are you talking about? Which outbreak?
The Avalon outbreak led, we believe, to...
Well, we have, can I say a couple of things? Firstly, I believe we have the best contact tracers anywhere that I've seen, anywhere in Australia and anywhere globally. And it's not to say we have all the answers, we certainly don't. But the point I'm making is this disease is so unpredictable and volatile that we may not have all the answers. And we have to be honest about that, and that's why we put in place the restrictions we do, because you don't have all the answers. If we had all the answers, you'd be able to ease some of the settings we have in place. But can I say this, that I pride myself in New South Wales. Our health experts provide information in real time, in a timely way. We try and make sure the public knows as much as we do, because having that information allows the public to make their own common sense approaches. Many people choose to actually be even more cautious than the health advice we provide, and that's a matter for them, especially if you have vulnerable people in your family or people who've got existing illnesses, and that is a good approach to take. There are varying degrees of what people are comfortable with. But to pretend that anyone on the planet has all the answers to the pandemic is just a misconception. It's just not going to happen.
To clarify, you're saying you cannot offer a guarantee that you will find out?
No, I can't offer a guarantee. I'd be silly if I did. I mean, we rely on the experts to do that work. Our experts are working day and night. But I'm also someone who appreciates that sometimes you might get the answers a bit down the track. And the key thing is for us to always lock down and identify those sources of transmission, which is why the Croydon cluster for us in particular is a concern. Until there's, obviously where the serology comes back later today, we hope that there will be a link established and we can have some more information to work from. But I think any political leader would be silly to suggest that all the answers can be provided. But what I do know is that we have one of the best teams in the world, day in and day out, doing the contact tracing and trying to get all the answers. And as soon as we have them, we'll share them with the community.
So you haven't been able to identify cases zero within all the beaches outbreak. Is it likely that we also won't be able to find the source of this protocol?
Well, that's a matter for the experts. And as I said, the testing is done continuously, and often, one test in one case or one set of circumstances can lead you to find those crossovers which are so vital. And sometimes it can take hours, sometimes it can take days, and sometimes it can take weeks. And only yesterday, Dr. Chant updated us on some unlinked cases which are now linked because of the serology that comes back. And what we're deeply grateful for is people coming forward and getting tested, especially even if you have an older case. If your CT value is so high, or if we can tell from the serology that you've had a case that's a bit older, the timing of your case may help us solve something else down the track. So there's lots of things, and Dr. Chant's probably in a better position to answer these questions than I am, but there's many opportunities for that cross-matching to occur. But we can't pretend that it's easy in all circumstances. And it's also as good as the information we're able to assess from the people that are interviewed. I mean, thank you to the people that for hours are on the phone or getting interviewed by our health experts. Thank you for everybody providing that information. And thank you to businesses who are keeping those good records, because it helps finding those crossover links. For example, if the strain from Croydon is linked to the Avalon cluster, then the contact tracers work overtime to say, well, what's a crossover venue where someone from that cluster may have been with someone from Avalon? What is that crossover venue? And that can solve a number of questions. So it really comes down to the science and the data. That's what we base all of our advice on. It's what we base all of the public information on. And I have confidence that if anyone can get to the bottom of it, it's our people here in New South Wales.
Dr. Chant, just without any balloon on, if I can ask you, yesterday there were those enormous queues for testing. Today it's dropped off significantly. It's almost deserted there this morning. Has the risk of Wollongong dropped away? Should people still be alert there? And has there been any results through from those tests yesterday, noting that it does take some time for those tests to get from Wollongong to the lab for testing, a bit longer than people expected?
We're expecting those tests to progressively come in. You're right, there is a little bit of a delay, but we're hoping to get those tests processed within 24 hours. That will help us identify give us some sense of assurance. It won't be complete because we need to wait that full 14 days. So again, thank you very much for coming out in those vast numbers. But remember, if you get new symptoms, or if you were tested and you were asymptomatic, and then now, a few days later get symptoms, you need to get retested. So depending on which category you are, whether you're a close contact, you need to now be in isolation for that full 14 days. If you're in other venues where we've just told you to monitor for symptoms and get a test, we appreciate your efforts, but please remember that if you get symptoms down the track, you need to get another test.
What's your New Year's resolution?
And so in terms of Wollongong, I think we'll have a better picture over the next 24 to 48 hours, but we can't give the all clear until we have a significant period of time where we're absolutely confident that there's been no community chains of transmission. So everyone down there needs to be vigilant, but please come forward and get a test. The services are available there, and anyone who has symptoms, please, can I just put out a plea that do not attend any family events, family gatherings, New Year's Eve gatherings. Go out and about if you've got symptoms. I think we want to all see a much brighter 2021, and we do have some hope on the horizon in terms of vaccines. It is important that we get to that no community transmission. We all have a part to play. So thank you for following that advice, please.
Do you have a New Year's resolution, professionally, personally?
I actually haven't thought about my New Year's resolution, but I think most people can probably imagine what it is. And I think it would be that we rapidly bring this cluster under control, we achieve no community transmission, but we need to remember we're always continually under threat, and so we are never going to go back to normal. We might get a little bit more normalcy once we have all the population vaccinated, but COVID potentially will change our lives at all times, and it may be something like the flu where we have to learn how to manage it with the tool of having a vaccine.
For literally years to come?
For literally years to come, and years.
Happy New Year.
Premier.